It's an oncoming Lasek.
Look straight.
Park Avenue Lasek 212-741-8628 in Manhattan.
Look straight to red light, okay?
The only non-cutting center
Stop moving your eyes.
that performs
Open both
exclusively
eyes.
advanced surface ablation, Lasek, and epilastic.
Don't close your right eye.
Don't close your right eye.
And don't move your head.
And don't move your head.
We have a coach, which is one of your family members, friends, or relatives, actually. Help you to be more relaxed.
Keep your right eye open.
Keep your right eye open.
Surgeon Dr.Chynn has over 20,000 cases, 0 losses, 0 settlements. It's a perfect clean record.
Red light. Look at the red light.
Part of the reasons
Don't move
he's
your
the
head.
only surgeon with that clean record is because he's the only surgeon who performs 100% non-cutting techniques in New York City. Procedure is completely painless. Takes only seconds to correct the shape of your eye.
You got 50 seconds.
Basically, laser beam is correcting the shape of your eye permanently.
Explain why they can't do -9 on a Lasek, you know?
It's the
40 seconds.
Yeah, it's basically -9.
Both eyes open again. No blinking. 30 seconds. Red light. Red light.
Keep your right eye open.
Keep your right eye open.
We are the only center who has open OR because we completely got rid of any possible complications here, not doing a couple of things.
10 seconds. Look at the right open. Keep your right eye open.
Open your eye.
Open your eyes. 5, 4, 3. Open your eyes. 2, 1.
So treatment is done. Mitomycin C?
Yeah, fixation was better on the right eye, I guess. Just note on the chart. So keep
That sponge is going to be holding a medication used to
Your
treat
right
high
hand.
prescription.
Both
So
eyes.
Ching is the surgeon using that medication the most.
Both eyes
Since
open.
by default he's treating the highest prescriptions in town. This is -9. A patient who is not a good candidate for cutting techniques like laser or intralace. We do perform a prescription higher than -10 at least once a week. And Dr. Chynn has a record of laser visual correction treatment in the whole US, a patient who was -22. And we have probably about 5 cases who are -20.
Keep them wide open. Look straight.
Now consider that -350 you are already considered legally blind. So -20
Close
is
your eyes fast.
definitely way beyond the limit that you could think could be
Wide
corrected.
open. When he tells you, don't do it fast. Remember that.
Few drops of Chynn uses to prevent scars, the steroid drops, the antibiotic to prevent infection.
Right eye open.
Basically less than a minute for a -10,
Straight.
and but an average of 10 seconds per diopter. As I said, you're gonna have Valium to help you relax. You're gonna have your companion, family member, friend coaching you. And it's a completely painless technique.
Keep your eyes closed. Into your squeeze ball. Then sit up with your eyes closed. That's what Torque does. How you feeling, okay?
Yeah, pretty good.
It didn't hurt, right?
It was a little harder than I thought to keep my eyes actually open.
I think the problem is you kept on trying to close your right eye or something like that.
Well, because when I had the bandage over it, it was
Yeah.
hard to tell if my eye was open or if it was closed.
Yeah, people
because-
find it hard to tell the right eye's open.
Yeah,
Because you got that little.
because I had the
Paddle,
bandage over
yeah,
it,
little
over
patch.
too, so if I had it open, I thought it was closed.
Yeah, because it's dark up there.
Yeah.
You did fine. Okay, so your your left eye was like a lot worse than your right eye. Okay,
Yeah,
so
yeah,
that's why
yeah.
it took like a minute. And then it's still short, but you were -9, which is Dr. Bailey was narrating 3 times what you were blind.
Yeah, I remember
Okay,
you telling me that.
so
yeah.
your right eye was bad and your left eye was super bad. Your left eye was so bad you couldn't even really get LASIK in that eye. Okay, that's why you had to go non-cutting. But we do non-cutting on everyone here because it's safer for everything. Okay?
Okay.
So what kind of stuff could you see without glasses or contacts 4 or 5 minutes ago? Like nothing.
Without?
Right? Yeah, nothing, right?
Yeah, it was pretty much I was legally blind. I couldn't
Yeah.
really,
Like, would you be comfortable driving a car?
Before?
Yeah, no way.
No,
How about like riding a bicycle?
No, no way.
How about like walking across a busy highway? Not
No,
really.
I wouldn't do that with perfect vision.
Just like unsafe, right? Okay, so what are you looking forward to doing, maybe this month, seeing perfectly without glasses or contacts for the rest of your life?
Let me see, I don't know.
Like a fun activity or sport, something like that?
I'd probably go and see some things over the day and at night that I probably wouldn't be able to see before, like go Yeah, swimming, well, not so much with the winter months coming up.
Yeah.
But pretty much when I'm at work and if I fall asleep with my
What kind of
contacts
work did you
in,
do?
paramedic.
Yeah.
So if I fall asleep with my contacts in, when I wake up, my eyes are very, very dry.
Yeah, like
it's
stuck
hard
to
to
your eyes.
Yeah, so I'm looking forward to not having to deal with
Sleeping with
that.
contacts also is not safe, okay? It's 10 times the chance of a bad infection.
Yeah, I mean, I try to take them out whenever I could, but sometimes
So
when
your
I was
hours
at
go
work,
crazy.
I got stuck, you know, so.
Okay, so when you open your eyes, the non-cutting procedure takes longer to heal than the cutting procedure, but the final vision is better, okay? So in other words, the first week you're not as good, the second week it's about the same, and starting by the third, fourth week, your vision keeps improving. So your vision is going to improve for like 3 months, okay? So it'll kind of be like you had LASIK in about a week or 2 weeks, but it's going to surpass it in a month, especially because your left eye, you couldn't even get the whole prescription out with LASIK, okay? So don't worry if it's a little bit soft focus, it's normal, okay? But when you open your eyes, this is not the best you're going to see, it's just a start. This is the worst you're going to see for the rest of your life, okay? And there's a bandage of contact lens in there, but there's no prescription in the bandages.
Okay.
So you ready to open your eyes and be amazed?
Sure.
You open your eyes. Hey, check it out. Isn't that cool? Yeah. When was the last time you saw like this?
Still pretty blurry, but yeah.
Like, what can you see? Can you read this?
The only thing worse is I still got all the water in my eyes.
Yeah, it's pretty good. How about you see NYU thing?
The bus?
Yeah, you should probably pan over there.
Langan Medical Center,
Yeah, you wouldn't be able to see that before, right?
Yeah,
You got the name of the bank?
I can tell by the logo it says Bank of America.
Yeah, that's pretty good.
We're located in the corner of Park Avenue
So,
South
you
and
can see
25th Street
it,
on the
right?
east side.
How about the sign on the back of the bus? You see what it's a sign for?
Ground floor.
Sleepies?
Yeah, before that you wouldn't be able to see that, right? Hey, congratulations, you did very well.
Oh, thank you.
Okay, want to say hi to your friends on YouTube?
Oh, yes.